Hi everyone, and welcome to Wellness Day, a podcast coming every Wednesday here from the Jahangir Wellness Center. My name is Pankaj Jain. I will be your host as we journey through wellness together. It's a long and beautiful world, but I'm joined here by Dr. Pankaj Jain from Jahangir Hospital, who is here to talk to us particularly about things related to the lungs. So thank you so much for being here with us, Doctor. So tell us a bit about yourself, Doc.
Hi, Kaus. Thank you for having me.
Absolutely.
My name is Pankaj Jain. Okay. I am working as a senior consultant pulmonologist in the Department of Respiratory Medicine.
What is that for people who don't know?
Respiratory medicine is the stream of science, medical science, which deals with the lungs, specifically as an organ, and the diseases related to lung.
Okay.
So I'll be talking and concentrating on the lung health and chest medicine, because lung and heart, they behave and function, and their functioning is dependent on each other.
Of course.
And very important organs: brain, heart, and lung. Three most important organs, which are essential.
I think heart is the superstar, no? The one that gets the most recognition.
The problem is, and I do have a complaint about this, that when we deal with the lung, it was always treated as a poor cousin of heart, and the whole attention is always given to heart. But since world has gone through a COVID pandemic, we are coming out of COVID pandemic, and now we saw the lung was the primarily affected organ due to COVID, and how much world has suffered. So many people unfortunately lost their lives.
Right.
And as obviously for survival, we have to breathe. And breathing and having food and water. See, I always keep on telling my patients, you can control what you eat, what we drink,
how we do for exercise or anything.
Yes. But about the inhalation, breathing, we have to inhale from the surrounding air. And we have to do that for survival. We don't have any choice about that. So we have to take care of our lung as a important organ for our health. And we have to take care of our surrounding. Second is, we need to be aware about the diseases related to lung, which can cause potential problems in the future, as well as the infectious diseases which can happen.
And as you said, now people are starting to become more aware of it.
Yes.
Now. So I'm glad
awareness has increased. So I should not be saying that. That has come out as a positive aspect of the COVID pandemic. Now people are aware about the lung. They are actively inquiring about the lung health and certain tests which they can do or perform to diagnose the lung-related issues beforehand, so that they can take corrective measures.
So here we're talking here, sorry to interrupt you, Doc, but we're talking from the wellness center. So from the aspect of wellness particularly, how I see wellness is, they're really, how I categorize it, or I have 5 pillars that I look at in terms of wellness, and that's quickly, I'll just go through them. One is movement, so exercise, what we were talking about. Nutrition, as again, we were talking about what you eat, what you drink. Your medical preventive health checks, that what we do over here, like I believe lung function tests, which we'll talk about soon, is one of the aspects of the medical aspect. So that's 3. 4th is your emotional and mental well-being, so stress and things related to that. And 5 being your lifestyle, what you do in sleeping, your recovery, your relationships, your hobbies and things like that. So all these things I consider
that will be a part of wellness
as wellness as a whole. So the question I have for you is, what does wellness mean to you?
See, when we talk about medical field, we have got different aspects of preventive health. See, one is once person have developed disease and diagnosed as a disease, then he will take a treatment. But having or doing something to prevent that disease, so we have got a primordial prevention, primary prevention, secondary prevention, tertiary prevention, something like that. So doing certain thing, be it changes in your lifestyle, food habits, or doing regular checkups related to lung health or related to any health of any organ, so that to diagnose if any abnormality which is there, and taking corrective measures so that that abnormality is taken care of. Or unfortunately, it has developed in the form of disease, we can take the treatment. One thing which I again want to point out, that every person who has got certain disease may not have symptoms. And particularly, which I have noticed, now our lifestyles are sedentary lifestyle. Like most of the people, IT guys working in office, they are rarely climbing stairs. You sit in the car from home, go to your office, do your job, come back and sit, watch TV and do something.
Very sedentary lifestyle.
Yes, sedentary lifestyle.
Yeah.
So, and in women, which we used to talk earlier when I was doing my education, medical education, which was also common in women in India, because they work in the kitchen or they may not be working outside and they may not notice the development of symptoms. So what happens is the disease has progressed to stage 3 or 4 in our terms.
Right.
Like person doesn't perceive the symptoms because he doesn't perform that task. Other problem in Indians, they tend to avoid that task because they feel that they will have certain symptoms after doing that test. Like
they don't want to hear.
The
even if there's
negative
something,
thing, like suffering from something. Like they will actively avoid climbing the stairs because after climbing 4 steps of stairs, they feel breathless. So they start avoiding that.
Oh, you mean that way? I thought you meant in the terms of like people don't want to do checkups because they don't want to hear that something is wrong.
That is also, I am coming to that because I was working abroad.
Where were you working?
I was in Muscat for 6 years and in Chicago for 1 year.
Oh, nice. Okay.
So what was the difference between the Indian and Indian subcontinent like Pakistan, Bangladesh, and the European and American people? When we ask for certain tests, if it is abnormal, I mean, if it is normal, the Indian guy will be disappointed because he says that he wasted money because he got the test result, which is normal.
Okay.
The reverse was true for the European or American guy. He will be obviously naturally happy that he doesn't have any disease.
Right.
For example, if I ask for PFT to diagnose.
What is PFT?
PFT is it's a pulmonary function test. We can call it a lung function test as well.
What does one do for that?
There is one machine with the pipe attached to it, and person is supposed to breathe in and breathe out.
Is that the one that you have to blow very, very hard into?
Yes.
Okay.
So that is called a spirometry. This test is widely available everywhere in India, including in Pune.
Now, what does it tell you?
I
mean, in broad terms and basic terms.
This tells us the functioning of the lung. See, there are 2 ways we can see the lung. One is X-ray. You must have gone, I mean, every person must have undergone an X-ray some or other time. Yes.
Like this.
So that is done for a fitness purposes most of the time. But that gives the anatomical appearance of the lung. It doesn't give a functional properties of the lung. So to detect the functional abnormalities of the lung, we ask for pulmonary function test. And that it's a simple test, but the only problem is it's effort dependent test.
Exactly.
The
You have to blow very hard.
has to blow very hard as fast as possible to see the abnormality in the lung functioning. So the alternative to that lung function test, recently we have...
Because you find people can't do that.
Yes, many times.
I mean, that suppose is the problem.
Problem is because patient is coming with the breathing trouble or lung related issues. We are asking him to breathe in forcefully and as hard as possible. So it looks... And there are certain diseases where it is contraindicated. Like if we are suspecting some heart disease.
Okay.
For example, if patient has got a history of heart attack in the past, he will not be able to perform or will not ask him to perform that test.
Right.
Or some people who have got a stroke or history of stroke. So these things are contraindicated for performance of that test. So newer techniques, say this modern medical science is evolving fast and a lot of technique, machines, technologies, they are coming up. Particularly in my branch, like respiratory medicine, if you ask, like just up to 2005, it was even branch name was chest and TB.
Okay.
So predominantly we used to deal with infectious diseases, including tuberculosis.
Yes. Okay.
But 2005 onwards, this name has changed. Now it has become pulmonology or respiratory medicine.
Okay.
And the kind of gadgets available or equipments available to detect and diagnose the diseases are, vast. And it is changing every year.
So you're seeing a very good progress, you're saying?
Yes.
That's good.
And diseases, like for example...
So diseases are also progressing.
Yeah, diseases are progressing.
Yeah. And that is why, because of things like...
5 years back, nobody had expected that world will shut down and all flights will cancel again. And COVID has given us, a reality check that health has to be taken seriously. So the spirometry, the alternative to spirometry or PFT, which I mentioned about, there is something called lung oscillometry.
Okay. So that's a different machine.
Yes, entirely different machine. And it's very... I like to explain this because there is very beautiful mechanism behind it.
That's the good thing about having doctors. They know exactly what they're talking about.
This is pretty old technology.
Most doctors.
1956, Du Bois has described this thing, but it never came up in actual use because it was not needed or nobody worked on it. But after September 11, that unfortunate attacks in New York, Trade Center, World Trade Center, a lot of firefighters who had suffered the exposure to smoke, dust and all, when they claim for compensation, financial as well, Their PFTs were normal. And when they were subjected to this oscillometry testing, what does exactly oscillometry means is there is one speaker which is kept in the mouth. It's a very small machine. You may not realize, person when saying.
So they put it in the mouth.
Yes.
Okay.
And it delivers the sound waves at the preset frequencies, 5, 10, 20.
Right.
And it goes with the tidal breath. Tidal breath means a normal breathing, the way we breathing right now, you and me breathing. So it goes along the tidal breath. They reflected back from the lung, be the airways and the alveoli. And there is one sensor attached to it. It catches the and
so basically the person has to breathe normally to get the same kind of test.
He doesn't come to know what is happening. Just have to breathe normally. He doesn't have to perform any maneuver. It doesn't have to breathe in or breathe out forcefully or rapidly. And that results will give us in the interpretation in the form of what disease probably we are dealing with. Obstructive airway disease, restrictive airway disease, and so on and so forth. So it's a good thing. It's not available widely, but we do have in our department.
At Jangir?
Yes, in the Department of Respiratory Medicine, Jangir, we do have that. In fact, wellness.
Also,
Yes, in certain packages we do.
Well, that's good to know.
Yes. So that helps in detecting the small involvement of small airways. Again, see, I'm going into little detail about the airways. What is airways means? We start breathing. That is called a trachea, windpipe. It's popularly known as. It keeps on dividing like a pipeline. So what we call it generations. So smaller generation airways where the particulate matter less than 3.5 micron gets deposited inside. And those are the airways are involved in the first instance, which are not diagnosed easily with the help of spirometry. And those patients we can diagnose with the help of oscillometry.
And that's just by putting this thing in your mouth. Very interesting.
And after saying this, I would like to come to diseases, for example, COPD.
What does that stand for? For people who don't know what that is.
It's a chronic obstructive pulmonary disease. So as name suggests, it's a chronic disease. Pulmonary is a pulmonology, respiratory medicine. And obstructive, because the predominant problem, the pathology is obstruction of the airways. So it's when we see lung, we can divide broadly in two parts. One is the airways, which carries the air from the atmosphere to the level where actual oxygen exchange takes place, which is called as alveoli. And the another group of the diseases which affect the part of the lung where actual oxygen exchange takes place. For example, COVID. COVID was affecting to the part where oxygen exchange takes place.
The oxygen side.
That's why people used to get desaturated, low oxygen, ventilator and all. But there are certain diseases like asthma. Asthma is an airway disease.
I see.
Where the airways are impacted, but the alveoli where actual oxygen expansion is not involved unless it is a severe asthma.
Right. So let me ask you a question here. Sorry to interrupt here. We're talking about this aspect. How are things like pollution now? Everyone is talking about pollution. For example, last year in the winter, everyone is talking about AQI. AQI is high. Is it you're breathing in 5 cigarettes a day or 20 cigarettes a day? What is your opinion on that?
Yes. And in India, we are dealing with two epidemics. One is smoking, where we get exposed to tobacco and.
But is that new or is that growing?
Yes,
more and more people are smoking.
Yes,
I can feel the
youngsters. They do.
The head of our production company over here is getting very nervous because he's also a smoker. So I'm going to ask you some advice on how we can get people to stop smoking.
Yes, smoking is the one aspect of it. Other problem which is increasing is vaping. That's something called e-cigarettes, which I would like to touch on that.
That's become a big
big thing is particularly younger generation, college going and office going and all. Because the misconception is e-cigarettes somehow are better or they don't have any harmful effects. That is a misconception, and
I think it's arguably worse in some aspects.
Yes, the problem with that, it contains nicotine, which is a tobacco. Cigarettes also contains the predominant, and it contains other 30 chemicals which can have their own devastating effects. Which are those chemicals are not present in the cigarettes. So how this thing came up actually, what happened is Philadelphia in US, they had a sudden spurt in the youngsters presenting with ARDS. So ARDS stands for Adult Respiratory Distress Syndrome or Acute Respiratory Distress Syndrome. So in this, again, the COVID-like things, oxygen goes down, patient requires ventilator and all. After investigation, they found a common link, that what we call as epidemiological investigation.
Right.
And common link was the vaping or e-cigarettes.
Oh, I see.
Yes. So e-cigarettes just do not cause all the problems which are there due to cigarettes, but they have over and above other effects which can be present as a life-threatening conditions like ARDS. So that is also the incidence of e-cigarette, use of e-cigarette is increasing.
Right.
Particularly in Pune, we see a lot of people.
Yeah. So how do we get people to stop?
Yes, that is the thing is increasing awareness, telling them that this is not the thing which they feel that it's not harmful as cigarettes. So we need to stop. And increasing awareness. Other thing which I would like to point out about the pollution.
Yeah.
India is the only country where COPD is seen more in non-smokers.
I see.
Yes. In Europe and US, when we talk about COPD...
So now you're giving smokers some...
Yes. The thing is, it is seen in smokers.
Yeah. But let me clarify. Smoking is bad.
Yeah, absolutely. I mean, I keep on saying that one cigarette, there is no justification, no excuse for even... I am not just saying smoking is bad.
That's what I want to clarify.
Second-hand smoke is also bad. So you should not keep a company. So, I mean...
Well, that's effectively what you were talking about in terms of pollution is effectively second-hand smoking.
So what we have got is outdoor pollution and indoor pollution. So indoor pollution, if you have got a group or company where person is active smoker, so you are getting exposed to second-hand smoke. So not just you should not smoke, you should not have a friendship or a company with the person who is smoker.
So basically you're telling me I should choose the head of my production? Okay.
So you should avoid his company. Okay,
fine.
Third is we spend a lot of time in indoor. Like 90% of the time we are indoor. So when I talk about pollution, people only think about the cars, exhaust, bus, and outside on the street and all. But it's not like that. Indoor pollution is equally bad.
Yeah.
And we tend to, do not take it that seriously because we are not aware there is something called indoor pollution. Now, I just want to mention about one radon gas thing.
Please, radon gas.
Yes.
Okay. What is that exactly?
Radon gas is actually produced due to the chemical reaction which occurs in the fossils and rocks.
Okay.
So, what WHO has found that most of the indoor places has got more radon gas concentration compared to outside.
How is that possible?
Yeah. So it comes through walls, cracks.
Oh, I see.
And yes. And there are radonometer or the meters which can measure the radon value inside your house are widely available.
Oh, yeah?
And they're not that expensive.
You can get it on Amazon?
Yes, I'm not exactly sure it's available on Amazon, but it's widely available.
That's useful.
Yes.
First time I'm hearing of something like
17 to 14% lung cancers are associated with radon exposure.
Wow.
So nowadays it has become a big, particularly in the closed environment, particularly basements, caves, where the ventilation is not there, cross ventilation are not there, windows on it. Especially the modern offices, IT offices.
Yeah.
There are a lot of offices which are closed all the time. They are not exposed to outside air, and they feel like air condition is enough to take care of that thing. But now the WHO is actively promoting that if you got a radon concentration in your office, yes. Third thing is particulate matter and pollution. Pollution is very important part which does cause lung issues, and COPD is one of the disease which can be caused due to exposure to pollution or pollutants. Other problem with the pollution is the asthma. See, most common reason for increasing the symptoms of asthma is exposure to pollution and viral infections.
Okay.
So those people who have got a well-controlled asthma, they can have an exacerbation in their symptoms or increase in their symptoms due to pollution. So that we need to, again.
Right.
Third thing which, not just, smoke, COPD, asthma, these are the diseases. But there is the third thing which I would like to emphasize upon, lung cancer.
Okay.
See, the Indian main, the most common cancer nowadays is a lung cancer. In women is the third most common cancer after cervix and breast.
Yeah.
In Europe and US, it's last decade or so, it's a most common cancer in women as well as men.
Okay. Why the difference over here?
Because we do not do again, now we are talking about wellness thing.
Yeah.
Pap smear, self-breast examination is not performed commonly in India. The awareness is lacking. The HPV vaccine, which helps in preventing the cervical cancer, is not widely used. Pap smears are rarely done. So we do not diagnose cervical cancer and breast cancer before it becomes, obvious, or it becomes stage 3 or 4.
Okay.
So
early detection.
Yeah, early detection. Again, the best example is US or Europe. 1970s, up to 1970s, the breast cancer and cervical cancer was among top 5 cancers in women in US. Now it's not even top 10.
Really?
Yes.
Okay.
Just because they are taking care, just doing the preventive checkups, mammographies, ultrasound if there is some suspicious lesion, biopsies, and effective care is available, provided that you diagnose that in early stage of the disease.
Okay. So, coming to the preventive side, what are the things that that we can do
for detection of?
One from the detection side, exercise, right kind of nutrition that we should be eating, vaccines that we should be taking. What are the kind of preventive things that we can do at a practical level, like me as a regular person who's not a doctor?
Sure. Yes, there are few things which we can do, and I'm sure, you don't need to change your lifestyle radically. If you do these things as a regular,
absolutely.
I think, in fact, person will enjoy doing these things, like doing 30 minutes of exercise every day for at least 5 days a week.
What kind of exercise?
Brisk walking is good enough form of exercise. But if you are interested in any sports, cycling, badminton playing, or any swimming, is as good as even jogging, running. The thing is, you should be doing it persistently and regularly.
Consistency.
What I see, consistency is important. What I see, one day person goes for 10 kilometers walk and 5 days he takes off. That's a thing which there. Other thing which you can do, as I said about the smoking, obviously we need to avoid and avoid the company of second-hand smoke as well. Third, smoking is very
important. I completely agree with you.
Third is tobacco in any form, not just smoking.
So chewing and things like that.
Tobacco, chewing, good.
But that affects the lungs also?
Yes. In fact, it affects more.
Okay.
Because, for example, in BD, there is no filter.
Right.
And that paper is thick.
But that's smoking?
Yes, that is smoking. And even tobacco, when you keep it contains the same thing. Because in the cigarette, we have a tobacco rolled in the foil.
Achha.
So that is the thing. Third is, what you can do is strengthen your muscles, exercise and all, which we saw. Fourth is vaccination.
Right.
And vaccination, for example, influenza vaccination. In Europe and US, everybody, flu shot is a routine for them. Everybody goes and takes a flu shot. In India, we advise to take an influenza vaccine to those people who are above 50 years of age, who have got some respiratory disease, for example, asthma or any. Still, the acceptance is not as much as we would like.
Yeah.
See, in ideal world, everybody should take a flu vaccine.
How often?
Once a year.
Once a year.
What happens is, why it is once a year? Because every year the strain which causes the flu, they change. And it's widely available, it's not costly, it doesn't have any side effects, and we have got plenty of experiences using flu vaccine because it's available since 50 years.
Right.
So it's easy, it doesn't have any side effect, and you can take the pneumococcal vaccine at the same time. So pneumonia vaccine, it's a bacterial vaccine, influenza vaccine is a virus vaccine. I will advise for everybody to take it. Pneumococcal vaccines are very effective.
Okay.
You don't have to take every year. Like 5 years protection is there with the pneumococcal vaccine.
Right.
There are multiple brands in the market. Influenza vaccine protection is for 1 year.
And we can take all these vaccines here.
Yes, we have got a adult vaccination center in our wellness clinic.
Right.
You can take it whenever you want to. There are no exactly contraindication for it. So even if person takes both the vaccine on the same day in a different hands, that is also acceptable.
Right.
It doesn't have any issues.
Oh, that's very good.
Yeah. Fourth thing which I want to emphasize about the lung cancer screening.
Okay.
So any person who has got any symptoms like blood in his sputum, or has got cough which is not responding for 2 weeks or so, has got weight loss, or any history of smoking, or any first degree relative with the cancer, he should consult a doctor. It's not like you have to come to us. You go to any doctor, get yourself screened with the
Absolutely, I completely agree with you.
So to diagnose the lung cancer. The problem in India is lung cancer is diagnosed in the stage 3 or 4. And every stage matters. If
we
you are
want people to stay well, that is our entire motto.
The motto is to stay well, diagnose diseases at the initial stages, if at all it is there,
Right.
so that corrective measures can be taken. And ideally, say, I want, as a doctor, nobody should get the disease and it should be diagnosed beforehand. That is what is ideal.
And that's the right
what we want.
philosophy that we want to.
That is what our idea behind wellness clinic is. Person should not develop the disease or diagnose in initial stages so that we can take or offer him some.
And I like the statement that you made when we were talking about preventive, that it should be enjoyable for you. It can be enjoyable.
Yes. So the thing is, initial stages, person feels he needs to do certain things which he may not enjoy. But once he start doing it, so I just want to touch, if you got few minutes to sleep about, I didn't mention about the sleep. See, sleep, we spend 1/3 of our life in sleep. And
some people spend more, but
yeah, but we take sleep, quality of sleep casually. We don't want to talk about sleep, and people, especially in India, people think, okay. The thing is, sleep disorders we are seeing so commonly, and there are the commonest sleep disorders, obstetric sleep. By the way, I'm a sleep physician as well.
Oh, really?
Yes.
Oh, I didn't know that myself. We must have a separate episode to talk about sleep. Because I've been looking for someone to talk about sleep, so we must do that.
So we do a sleep studies and diagnose sleep disorders. So my message, take a message if those who are listeners. So first thing, yes, you do take care of your lung health. Do checkups regularly. And if there is something suspicious, do consult a pulmonologist. Don't hesitate to ask us questions about your lung health. Third is, sleep is very important part of life. And if you have any sleep-related issues, you can always consult us.
Absolutely.
You may or may not require sleep studies. That's a different issue. Do not avoid vaccinations. That misconception of vaccinations is meant for children. So that is what people feel. बच्चों को देते हैं. It's not like that. There is something called adult vaccination. Diseases just do not happen to children. Diseases can happen to adults as well. And as our life expectancy is increasing, the big part we have to spend on these wellness things because
we want quality of life to be as good as life expectancy. There's no point of being able to live to 100 if
so
you
person who is got a COPD, he may have some medicines and he may survive, but his quality of life will be, hampered. He will not be able to have a good quality of life. So that is one idea behind this.
Absolutely, that's what we want to do.
Yes.
Thank you so much, Doc, for being here. I think you've given us a full insight about how wellness plays into every aspect.
I try to cover the other aspects related.
I think we'll have to have another 2-3 episodes to talk about various different aspects.
But just want to mention, if you have any problem related to lung or chest medicine as a whole, you can always come or consult us or give us a call, and we'll try to solve or cure or give something to take care of that problem, so that the person should not have a problem.
That's what we're here for. We're here for not just getting well, but to stay well.
Yes.
So thank you very much, and look forward to joining us for the next episode. Thank you.